Miss Williams?
Yes,
Nice to meet you.
Nice to meet you.
Okay, can you tell me what brings you in today?
So my vision has gotten worse for the past couple of weeks, and I feel like it's getting more serious. I went to the drugstore to buy some reading glasses, but that didn't make it any better. My hands and feet are also tingling, but I don't know if these symptoms are related.
Okay. Does anything tend to make your vision worse or better, or do you see different changes depending on the time of the day?
The vision is for the most part constant, but I noticed that it worsens in the evening, especially when I'm driving at night.
Okay. So you said your vision, you have blurry vision. When this happens, can you describe your visual field?
Yes, so it seems like things are floating across my eyes. Is that normal? Does that sound strange?
Well, okay, we'll certainly take a look at that. Okay, so can you tell me, I have to get a complete picture of your history. So can you tell me what types of medical problems do you have?
So I have hypertension, but I haven't been managing it as well as I should. I also have high cholesterol, and that's another thing that I need to focus on managing and getting up on my medications with that as well.
Okay. So also, what about your family history? What diseases run in your family, especially regarding vision?
So I don't think any eye issues run in my family history, but I know my father passed away from a heart attack at age 60, and my mother has angina pectoris, and that's it as far as my family history goes.
Okay. So can you tell me, do you smoke, do you drink, or you take any recreational drugs?
I smoke back a day. I drink like 2 glasses of wine a day, but I don't take any drugs, and that's it as far as that goes.
Okay. Okay. So now I have your social history too. Okay, Miss Williams, can you tell me, what do you do for work?
I'm actually the secretary in the administrative office at a school.
Okay, that's nice. Let's see here. Yes, I had the nurse get your vitals. I see that your blood pressure was 152/92. So yes, that's something that we definitely need to manage, that hypertension. That's going to be very important. Okay, so let's start the examination first. We'll have you step up to the Snellen chart so we can check your eyes.
Okay.
Okay, stop right here. So what I'm going to have you do is cover your left eye with your hand, and continue reading until you can't see the letters.
Okay. D, E, F, T, O, D. I can't see anything else after that.
Okay, so let's have you do the same thing with your right eye.
D, E, F, T, and I can't see anything after that.
Okay, okay. Okay, good job. So let's go back to the examination table so I can get a closer look at your eye. Okay. So we're gonna check your visual fields, but I'm gonna lift my hands. Tell me, can you see my hands on your peripheral vision?
The furthest I can see is, keep going, right there. I can't see past there.
Okay. So what I'm gonna have you do now is you cover your left eye, and I'll cover my right. Okay. And tell me if you can see my hand moving.
I can't see past there.
Okay. So we're gonna switch it. And tell me if you see my hand. Tell me when you see it.
I can't see past there.
Okay. 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 So now I'm gonna physically inspect your eyes. Okay. Let's look at this one first. Can you look up for me? Okay. Can you look down? And to the left? And to the right? Okay, good job. Let's do the other one. Can you look up?
Okay.
Down? To the left? To the right? Okay. So now I'm going to check your lens and cornea.
Okay.
We're going to do the pupillary reaction test.
What is that?
Okay, it's to check the motor and sensory functions of your eyes.
Okay.
Okay? I'm going to shine a light. Okay. Okay, right, so now let's take a look at the back of your eye.
Okay.
We're gonna take a look at the optic nerve, the retina, and the blood vessels back there. So I'm gonna use my ophthalmoscope. What I want you to do is to focus on the spot on the wall behind my shoulder,
Okay.
and I'm gonna press on your brow. Tell me if you feel any discomfort. Okay? Now for the other eye. Okay, thank you. Okay, so I'm gonna just listen to your heart and lungs real quick.
Okay.
Okay? Okay, now take some deep breaths for me. Okay? 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 Okay, great. I'm gonna go leave the room, I'm gonna chart, and I will come right back, okay?
Okay.
Okay, Miss Williams, we need to have a discussion about what's going on. Okay, so I have a lot of things that that we need to do to manage this condition. You have moderate diabetic retinopathy, and it's a condition that's going to be managed. What we're going to do first is get you set up with the eye clinic. We're gonna I'm going to refer you to an ophthalmologist because I need you to establish a relationship to manage this so it doesn't get any worse. And I'm going to give you some prescriptions. We're going to give you prescriptions to reduce the fluid in your eye. There's a prescription called triamcinolone, and I'm going to give you that. And then we're also going to give you glucophage. We're going to up your glucophage up to 850 milligrams 1 time a day, and then 2 times in 2 weeks after that. And then we're going to up your atenolol also to 80 milligrams. To manage your high blood pressure, okay?
Okay.
And then your blood work came back, and your A1C is 8.13, so you have to get that under control, right?
Mm-hmm.
Yeah, because your A1C is a broad measurement of your blood glucose over a 3-month range, so it's important that it's at a manageable level, okay? And then yeah, with your diabetic retinopathy in your eye exam, I saw exudate and retinal ischemia. The retinal ischemia is the lack of blood flow, so that's what's causing you to have the blurry vision. You're not getting enough blood supply to your eye, which is important. But with these medications and the treatments, we should be able to improve that. Okay? And so as part of your plan, we have the prescriptions, and importantly, we need to control the diabetes, the hypertension, and the hyperlipidemia. Also, I'm giving you Lipitor, 40 milligrams to control the cholesterol. Okay, so we also have to talk about some lifestyle changes. Fruits and vegetables. Do you have a grocery store that's close to you?
Not really. The closest grocery store is like 10 miles away, and I don't have a car, so I'm kind of in a tight bind when it comes to getting fresh produce. Do you have any recommendations for me?
Okay, that's something that's common to a lot of my patients. For some of them, I've recommended a grocery delivery service, and it's comparable to prices at the grocery store. And hey, it takes out you having to go there. The food will come to you, and it has a small delivery fee. But that's a good option to start getting a healthy diet, which is necessary. Okay, and we also need to talk about the smoking, right?
Doc, I've been smoking since I was in my early 20s.
I know. We're not asking you to go cold turkey right away. We're asking you to reduce, because smoking it causes chronic inflammation in your body, and it worsens any chronic condition that you may have. Okay, along with exercise. You know, we got to start walking 3 to 4 times a week at minimum. But we got to start moving and get 30 minutes in. You'll start seeing some results for that. Okay? So that's the plan that we have in place right now, and we're gonna get you set up with those appointments. Do you have any questions for me?
No. Are you going to set me up with an ophthalmologist? Or?
Yes,
Okay.
yes. That is. He's going to be Dr. Sharif. I'm going to refer you to him. He is a great ophthalmologist, and he has great reviews from patients, and he's very professional. So I trust him to be a member of the team in your care.
Okay, thank you so much, Doc. I'm hoping that when I go to him that he is able to repair my vision, and I'll try to set an appointment with you within the next month, and I will be incorporating the lifestyle changes that you recommended into my schedule. So
Okay.
hopefully we'll be seeing some great results.
Okay. I look forward to continue working with you.
Okay.
You too. Okay. You can go to the front desk to check out.
Okay.
Thank you.
Thank you.